Hi everyone, my name is Joel Veldhouse and I am a doctor with Lakeshore Health Partners. Today we are doing a Facebook Live event to promote men's health here in Holland, Michigan, and of course since we're on Facebook you can pretty much join us from anywhere. I do have a Facebook account, but I've never actually gone live before, so I think this is something new probably for me and for the other doctors who you'll meet tonight. My portion of the event tonight is to talk about primary care providers and why it's important to have a primary care doctor, what they can do for you, how to find one, and anything else related to that. If you do have questions, I believe that you can type into Facebook any questions that you have. I'm going to be talking probably for about 5 minutes. And if you have questions that pop up in your head, I would just type them out and send them over right away. After my short spiel here, you'll be able to also send in more questions if you want. I'll just wait for a couple minutes and make sure we don't have anybody who has any questions to ask. I'll be first, and then you'll be talking with Dr. Ludlow about men's cardiovascular health and erectile dysfunction, and then talking to Dr. Michael Ridding about primary care, normal things that happen in the primary care office and how to treat them. To start today, I'm supposed to talk about the importance of having a primary care provider. That's a really loaded question. There's many reasons why you should have a primary care provider. You know, the first thing that I thought of is kind of the times that we're in right now, the uncertainty that people are having in regards to coronavirus and all the things that comes with that conversation. Let's just say I've had lots of conversations about that, on educating my patients on how to act and react and even what to do with their businesses. But the thing that really brought that full circle for me is that really, you know, anything can happen to you. I think men in general probably have this feeling that they're invincible. They've maybe had that feeling since they were 7. And the simple fact of the matter is that men aren't invincible. In fact, men are probably less invincible than women. And you really never really know when something is going to happen to you. And when you access the medical care at a hospital or a new facility that you've never been to, it can feel very overwhelming. People tell me that pretty much all the time when they come to me after the hospital. But what's not overwhelming is when you have a primary care doctor and you have someone that is going to be able to process that information for you and be there for you when something does happen. I find that the people who are most grateful are the people that are the sickest and come to me and follow up from the hospital and talk to me about what happened, how to stop it from happening again, and how what I can do to help them do that. And that, to me, having that safety blanket, having that person that you know, you trust, you've already talked to before, that you can call and ask questions about if something does happen to you, is the most important thing and the biggest reason for me why you should have a primary care provider and why everyone in your family should have a primary care provider. Our offices are called Patient-Centered Medical Homes. Many offices in the Lakeshore Health Partners Business Association are Patient-Centered Medical Homes. Basically, that means we have a team of people who are providing care for you. It's not just me as your doctor providing care for you, although I am the person that you will talk to the most and the person you will talk to when you come to the office. But I have nurses who take phone calls every day for me. I have front desk staff who run insurance cards and answer questions regarding finances and things like that. I have a care manager who helps me manage really complex problems like diabetes, heart disease, hospital follow-ups. So patients have more than just one person that they can contact, because obviously I'm not available 100% of the time. So a patient-centered medical homes means that we can take care of you from the day you walk into the office until the day you either walk out or I walk out, which probably be a long time considering I'm a young and youthful doctor. For men who have a primary care doctor, I recommend they see their primary care doctor every single year. For men who are really healthy and in their 20s, I often let them see me just every 2 years. Once, and maybe if you're really healthy in your 30s, every 2 years, but once men reach 40 and above, I pretty much recommend a yearly visit to see their doctor. The major reason why I recommend that is just another reason why seeing a primary care doctor is so important is just that I find stuff. You know, there's a lot of silent diseases out there, high blood pressure. Lots of times people gain weight silently. They're not even really thinking about it. The only person that actually brings that up to them is their doctor. Most of the cancer diagnosis that I've actually made in my office has been at physicals, just routine people who felt healthy, and I found something on exam or asked them a few questions and found something. So for me, every single year, a yearly exam by a doctor is well worth it. It doesn't mean you have to get blood work or anything like that. It's just a talk with the doctor and a physical exam where the doctor lays hands on you. And most of the time that should, reassure you as to your health or find any significant problems that might need to be treated or followed up on. If you don't have a primary care doctor, I highly recommend you get one. We do have doctors available through Holland Hospital and through Lakeshore Health Partners that are available to see patients. You can go to hollandhospital.org or lakeshorehealthpartners.com, and there's search engines on there. You can just click find a physician and you'll see a bunch of names pop up. What physician is the best for you? I'll just take you through that a little bit. A family medicine doctor is considered a primary care physician. A family medicine doctor is trained to see all age groups and includes pregnant women. If you are a person who doesn't have a severe or complex disease and you're relatively healthy, a family practice doctor is probably the right person for you. I myself am an internist. I'm a board certified internal medicine doctor, and I'm also a board certified pediatrician. So I actually have 2 board certifications to see patients. Internal medicine basically means that you're 18 years and older. Pediatrician basically sees 18 years and younger. When I bring that into my practice, that basically means I see all age groups. But in my training as an internist, I generally saw a little more complex conditions and had a little more time spent in the hospital treating complex conditions. So if you're a person who has more complex problems like multiple problems, diabetes, high blood pressure, or maybe you have some unusual or rare diagnosis, seeing an internist might be a better choice for you than seeing a family medicine doctor. There should be easy ways to get a hold of a doctor, not even just going to those websites, but I'm sure you could just Google find a doctor in Holland, and most of our doctors are going to be available. And then you just can call the numbers, and we should be able to direct you wherever you need to go. If you have any questions right now, please send them forward. I hope that pretty much sums it up for me. It's easy for me to promote my job as something that's crucial for you, but I can tell you that I have a full patient panel. I'm not really even accepting new patients at the moment, and it's still something for me that any of my friends who would ask me, my dad would ask me, my brothers would ask me, I would tell them, you should have an established relationship with the physician because you don't know what's going to happen, and your doctor usually sort of does know what can happen to you and can help you avoid those problems in the future.